Chronic obstructive pulmonary disease, also known as COPD, is a group of respiratory conditions that makes breathing difficult for millions of Americans. In the United States alone, COPD was the fourth leading cause of death in 2016 and is currently the sixth as of 2021. Cigarette smoking is the most common cause of COPD in the United States. According to the National Survey on Drug Use and Health in 2021, 20.3% of the general U.S. adult population smoke cigarettes. This rate is higher in rural, with nearly 29% of rural adults smoking cigarettes as well.
Well, in the rural space, nationally, we have 1 out of 8 Americans that suffer with COPD. We find in our rural areas that you also have more smokers, you have less adherence to medication regimens, and then less access to different care. So the pulmonary rehab in the rural space is so important because otherwise these patients probably wouldn't get the treatment that they need. We all are very aware of the transportation issues that our rural Americans face. So pulmonary rehab is a great resource for these communities so that their patients can be cared for.
And I would certainly add that environmental factors as well as industrial factors in the rural space also contribute to higher lung disease in the rural population as well. So the rural environment needs more treatment options and access to care for these lung diseases.
In 2021, Expanding Rural Access to Pulmonary Care, a Health Resources and Services Administration demonstration project, was launched by the National Rural Health Resource Center and rural hospitals that serve communities with high mortality rates from COPD. This project helped rural hospitals with assessments, resources, and education to offer pulmonary rehab services to more communities around the country, increasing access to pulmonary care. These services can enhance lung function, reduce the need for supplemental oxygen, and improve quality of life for those suffering from COPD.
Pulmonary rehab is the single most clinically effective and cost-effective treatment for COPD and other chronic lung diseases that we have available. Pulmonary rehab is actually more clinically effective, more cost-effective than all the inhalers that we're spending billions of dollars on. Inhalers are important, but when you rank the effectiveness of things, whether it be in saving money for states and Medicare or helping people stay alive with good quality of life, pulmonary rehab is the best.
Pulmonary rehab, it is really identifying your triggers. It is looking at what can I do? We know when you have pulmonary disease, no matter what it is, it's likely incurable. Now long COVIDs we don't know about yet, but some of them, your COPD, your emphysema, you're going to have that for your life. So what can you do to help you have better quality of life with the disease? So let's look at exercises. Let's look at diet. Let's look at our medications. Are there medications that we should not have? And then what are our triggers? If we have certain triggers that are affecting us, is it car exhaust? It's really kind of identifying what can I do? And then what can I do to help me? How can I increase my level of stamina?
From the studies that we've been able to read and take a look at the analysis, it shows that there is nearly a 40% impact in lowering that mortality risk at year 1, which is significant. And this was through Medicare beneficiaries that were hospitalized with COPD and then were prescribed pulmonary rehab within 3 months of their discharge.
And I'm embarrassed to say that I was in practice for 35 years or more before I actually started sending people for pulmonary rehab because I just didn't know about it and it wasn't available where I worked and practiced. And so I learned late in my career about the importance of pulmonary rehab and became very involved in being medical director of a statewide network, improving access to pulmonary rehab in rural areas, remote rural areas.
Sparta Community Hospital opened its pulmonary rehabilitation services in February 2023. It started by offering services 2 days a week, but quickly grew to 5 days a week. The growth and success of their program proved the need for pulmonary care options for Sparta and its surrounding community.
I'm Carol Kramer, Pulmonary Rehab. It's helped me a lot. I was pretty bad when I first came. I had anxiety real bad just from getting in the car, out of the car, into here. Took a lot out of me. And I was pretty weak. I'd lost a lot of muscle mass up here in my upper chest. I hadn't exercised in a long time. I'd get out of the hospital, and by the time I regained my strength to where it was like normal, it really wasn't.
Carol has been amazing. So when she first came in, she was very scared, nervous, anxious. From the start when she was here to where she is now, she's not using a wheelchair. She's using more equipment now. She has actually been on that treadmill 3 times already with me.
I can stay up longer on my feet, unload my groceries out of my car.
She does not give herself enough credit. She has accomplished so much here and has been great inspiration.
When asked why Sparta Community Hospital started a pulmonary rehab program, Chief Nursing Executive Lori Clinton named COVID as a huge influence in her decision to help bring pulmonary care to Sparta.
I worked the front line in nursing the whole almost 3 years of COVID. And all we seen was ventilators, airbows, trilogies, high flow oxygen, very, very critical sick patients, deaths, readmissions, and the aftermath of COVID, they would end up right back. And the symptoms just kept getting worse and worse and worse. And it's like, there's got to be more that we can do. So we have a pulmonologist that's just an outstanding doctor, Dr. Barkowiak. So we started conversation with him because we were going to have a medical director if we were to do this. And he has always wanted pulmonary rehab. Dr. Barkowiak and I had conversation in the past. So he was excited, I was excited, and we said, let's do this. We knew we had to offer this program to help our community, so that's what we did.
Sparta Hospital employee Kansas Beery is also a patient of the hospital's pulmonary rehab program. Here, she explains her rare lung disease and outcome because of pulmonary care.
So I got diagnosed with a rare autoimmune disease called sarcoidosis about 1.5 years ago. It mainly affects people with it affects the lungs and affects the lymph nodes in most people, but then it causes breathing issues and joint pains and different stuff like that. So I got diagnosed about, I think, 6 months before pulmonary rehab opened. So I see a lot of the paperwork in my department before it comes out. So one of my coworkers actually showed me the list and said, hey, you got to see this. So she showed me the paperwork before it came out that, hey, we're having this pulmonary rehab start. Your disease is on there, like as somebody that automatically qualifies. It almost brought me tears because I was like, nobody even knows what this is, let alone that now our local hospital is going to have something to kind of help people out with that. So it's been really positive. The biggest thing is the stairs at my house. When I would do laundry before and I would get done with the laundry, I'd come upstairs, I'd kind of have to take a second and pause before I would go on with something or else. But now, then I can tell I don't get worn out as easy. I haven't had to use my inhaler as much in my other training. Like I have a personal trainer too that I see at the gym. And I used to have asthma attacks a little bit more often with him. And now I'm not seeing that as often either. So it's really helped my breathing.
Sparta Community Hospital is definitely making a difference for our pulmonary patients or even our cardiac patients as well, because with us being a small community, there's not many options for anybody around here. You have to drive to St. Louis, and a lot of our elderly patients, it's hard for them to drive or find somebody to drive them. And a lot of patients are calling in like, thank you so much, didn't know this was happening. I want to be part of this program. How do I start? So just a lot of different hospitals that are connected with us have been reaching out to us to have their patients come here.
As patients like Kansas increase their quality of life by participating in a pulmonary rehab program, rural hospitals are benefiting by expanding access to pulmonary care as well.
As far as financial benefits, to date, I think we've had like 439 rehab visits. So certainly the revenue generated from the additional 439 sessions is a positive, but actually it goes much deeper than that, because today we're all about population health. We're about people having a quality of life, and we're about making our community better. Because if we can get them better, they have less healthcare spend and higher quality. So that's what it's about. So the long-term financial success remains to be seen, because we will see them being more of a certainly valuable part of the community, as well as they increase their quality of life and also hopefully have a better physical condition as well.
The outcomes and the positive outcomes of patients that go through a program, from a clinical standpoint, the goal is to really increase lung function and their level of function. Are they walking longer distances? Are they breathing easier? Those are really, positive outcomes from a patient perspective. But for a hospital, certainly once you get the program rolling, it's an additional revenue stream for your hospital. There is also, from the external perspective of the community, looking at your hospital, you're providing a greater need, a greater access point for community members that might need these types of services. And so, it's a good image out in the community that you're kind of continuously evolving. And there's also, if you are in some type of accountable care organization or some type of value-based program, you're really focused on population health. And given the high rates of COPD and the cost on, or the length of stay for these patients, and the increase in readmission of these patients to the hospital system, and increasing the cost of the hospital system, you really want to focus your efforts on improving the health of this patient population. And that will have a downstream effect as it relates to your ACO or your alternative payment programs that you may be participating in. If you can, really start to improve the outcomes as well as the cost of that patient population. So there's some really great outcomes when we think about implementing a pulmonary rehab program.
Pulmonary rehab can be, if designed well, a holistic approach to addressing your patient, because there are nutrition needs for this population that need to be discussed. More medication management. Are there social services that they need to be successful? There are a lot of things that go into helping this population. And then, as Lindsay said, to help build the health of this person and keep them from the readmitting or having avoidable ED visits, because they have then become healthier.
So top benefits of pulmonary care, it's really, we are wanting to reduce the symptoms, the shortness of breath, all the things that go along with that. We're wanting to improve quality of life by giving someone the tools they need, and then really giving them a long-term path to stay successful.
Starting a pulmonary rehab program may sound like a daunting task, but the Expanding Rural Access to Pulmonary Care project demonstrates it is possible for small rural hospitals. The center's model offered assessments, resources, and education to help rural hospitals explore the feasibility of expanding pulmonary care. With help from consultants and partners, the center also developed a toolkit to help rural hospitals get started. It outlines the basics of pulmonary rehab, billing and coding, patient engagement and education, and a series of learning collaboratives to help launch a program.
What is in the toolkit really starts kind of high level, whether you're a hospital administrator or if you are somebody that's a frontline staff clinician. If you can pick, or even a community member, pick this toolkit up, and it really just provides a nice overview of COPD, the clinical diagnosis and treatment of COPD, and then really solutions and services and opportunities for rural hospitals and their communities to try to think about how we can help these patients, these rural Americans. And so we have really laid out a nice outline of how hospitals can think about implementing a pulmonary rehab program. In additional treatment services such as smoking cessation, programs like that really will help support patients that are diagnosed or may not even know they have COPD.
We have done 5 education sessions on video. They're YouTube videos with resources to really, look at what do I need to do to get started with pulmonary rehab? And then we look at billing and coding, your staffing, your education for your staff as well as for your patients, the training involved with it, how you address your patients, the charting documentation, your physician oversight, and the equipment that they need, to get started. We have it all outlined in a nice little platform for everybody.
If you are considering opening a pulmonary rehab, you definitely would want to do a feasibility study. If that looks as though the pulmonary rehab is something that you want to go ahead with, remember that equitable care within our communities is so important and is in the spotlight of CMS. And to provide equitable health care, given access to this population of patients, demonstrates your commitment to providing healthcare services that are needed.
And I am so thankful for this program and that center. It's been phenomenal what they have offered to us. So really, our CEO, who's my direct boss, he received an email. We had already participated in another project here at Hood before I joined the team. And so I had just gotten here and he's like, what do you think about this? Like, do you think this is something that's important? Do you think we should, look into this? And I was like, absolutely. It's absolutely important. So we started, of course, just going through the approval just to make sure they did a feasibility study. They researched the area. And one of the interesting things that came out of that, our parish has the highest prevalence of COPD in the whole state of Louisiana, right where I'm sitting. And so there's about 137,000 people living in our parish today, and we're at almost 9% prevalence of COPD in our parish. So that's over 12,000 people in our parish. There's only one other pulmonary rehab in our parish, which is from where I'm sitting 30 miles away. So it was a no-brainer. Once, the data came in and we looked at, wow, there's a lot of people that have a need for this in our community. We definitely wanted to be able to provide that.
The center helped us with the implementation and more or less step by step what we had to do from a setup, the regulations, the billing, the coding, and so that was all tremendous. And then also the marketing toolkit that was provided to us was a master to go by. So it was a great benefit because in a rural facility, smaller facility, we wear many hats and people do several different things. So it's nice to have that assistance where you can just modify something and then run with it.
If I could promote anything, go to the website, go look at the tools that are available, go look at the marketing tools. Oh my goodness, they are amazing what was created for our small and rural hospitals, because a lot of times we don't have that accessibility to somebody in marketing, and they've just done an outstanding job.
Whether, we're consultants or practitioners, or even just, our C-suite within the hospital, it would benefit us to take a look at the Rural Health Center's toolkit and be able to, look to see if this is something that we can offer our community. And this kit itself, I think, is pivotal in the fact that it offers another leg to the healthcare business as a whole, but then also it offers another lifeline for the patient to help them get healthy and stay healthy as best they can to get back to their baseline.
You need to do it, definitely need to do it. Your community deserves this service, and you need to work through Any hurdle you find, there's always an answer, there's always a way to get through it. Collaboration is what I would suggest. Dr. Barkowiak has another hospital that he goes to in the city. He is so impressed with this one. He literally sent his folks to us from his cardiac rehab program to for us to help them get their feet on the ground. We shared policy, we talked to them, we had Zoom meetings with them, and they're rolling their program out.
My advice to CEO would be, if you have pulmonary disease in your community, look for the funding if needed to open the program. Because although in the beginning it may be a short-term gain, there's not going to be a tremendous amount of revenue right now, but the end result is going to be tremendous as we get patients healthier and try to help them with their comorbidities to live a healthier life and reduce actually healthcare spending in the long run.
And I will tell you, there is, often not a big dollar amount of revenue that you're going to see from this, but it's the rest of the services that come with it. You might be getting x-ray, you might be getting lab. They're going to see the value in the rural community, the rural hospital, getting engaged and becoming that, I want to be the provider of choice in my rural community. I don't want them to think of me as just a small rural hospital that they have to go to the urban, that we can provide these services close to home.
I also think hospitals should consider, if they feel as though they don't have the volume to support a full-time program, consider the possibility of blending cardiac rehab and pulmonary rehab. That's a potential solution to the volume. I have seen hospitals have pulmonary rehab 3 days a week and cardiac rehab 2 days a week. You're utilizing your equipment, you're serving your community, and you're bringing in more volume to support that investment that you've made.
With support from state offices of rural health, state flex programs, and the Federal Office of Rural Health Policy, the Center is committed to expanding rural access to pulmonary care. Programs like the Delta Region Community Health Systems Development Program and Technical Assistance Services Center provide rural hospitals with dedicated resources to offer pulmonary rehab to their communities. Chronic obstructive pulmonary disease accounts for the majority of preventable deaths from chronic lower respiratory diseases, and the mortality rate is nearly twice as high in rural communities. Download the COPD and Pulmonary Rehab Communications Toolkit and learn more about these life-saving services by visiting our website.
I feel I have resources, I have connections, and it's not just me trying to figure everything out. I have people that, they are the experts. And so the willingness to make this happen for rural communities like ours, it's just, it's pretty awesome. It's remarkable.
The only thing I'd like to say is that certainly Delta helped us. And honestly, if it wouldn't have been for that opportunity, we may not be here today talking about our pulmonary rehab program. Certainly, it's been very, very worthwhile, more than I can express. They've been very helpful. It's kind of been a turnkey approach, and we're very, very delighted to be part of it.
My ultimate goal is that people are living free beyond the age of 65. By living free, I mean they're able to go where they want to go, they're able to drive their car, they're able to hang out with their grandkids, play ball, go fishing. They're able to have an active life and not be prematurely dead, prematurely disabled, confined to home or a nursing home. So my goal is living free, good quality of life, freedom from constant pain and shortness of breath and suffering, not spending the last 10 years of your life sitting in a recliner on oxygen. So that's a big challenge, and we have a long way to go to getting pulmonary rehab services to a greater percent of the people who need it.